Well, today we're answering that question for all the parents out there. And here to help us save our baby's skin is board-certified dermatologist Dr. Rita Linkner. Dr. Linkner, thanks for being here today.
Thank you guys for having me today.
It's a pleasure.
Thank you. So as a mother of two, I will tell you, it's so true. Baby skin is sensitive, and it has to do with all those changes that are happening on the surface of the skin, with the pH changes, the infrastructural proteins beneath the surface of the skin. Remember, it's the body's largest organ, but it is more like a sieve when we're little. And that delicate sensitivity means you have to pick the right products when it comes to your child.
Well, and that was my question. I'm sure baby skin, infant skin is different.
Completely. And you have to think about what those changes are. And when we're walking down that aisle in the drugstore picking out products, remember to go for that less is more mentality. Simpler, fewer active ingredients, the ones that leave out those common allergens, and the ones that are jam-packed with hydrating emollients. Those are the ones that I like to pick out for my kids in particular.
Gotcha. So the specific question is, Dr. Linkner, is there a difference between the adult products for those formulas versus those formulated for babies?
For sure. You'll see the product number of active ingredients is just going to be fewer when it comes to kids' products. It's definitely just a simpler active ingredient list. When you're reading that label, you'll just notice there are just fewer ingredients that'll be listed.
So, Dr. Linkner, can you run through it? What are the most common skin conditions new parents should look out for when dealing with their kiddies?
I would say the three most common that I see: diaper rashes, viral exanthems, and then, of course, eczema, which we also call atopic dermatitis.
Okay. Now, you call out baby viral exanthems. That's a mouthful. Break that down
That's
for everyone.
That's a good scramble word.
That is.
You'll get like triple-double letters for that one.
Break it down for us. What exactly is that?
So in the pandemic, fevers and rashes, I think, has all of us as parents riled up these days. But you should know they're very common self-limiting causes of just rashes and fevers that come together. Rubeola, roseola, scarlet fever, those are just some of the common ones. I think the first big tip I would give, try to do a telemedicine visit with your pediatrician, and they can oftentimes decide if you need to come into the office and diagnose what's going on beyond that.
Okay.
That's one of those areas where telemedicine is huge. I mean, for a dermatologist, you know your eyes are trained what you can differentiate.
Yes. In the pandemic, it's shifted a lot to tele. It's true.
All right, so let's talk about eczema, and it's, you know, it's a common problem, and in fact, this month is Eczema Awareness Month. So what do we need to know about eczema, Dr. Linkner?
Yeah, eczema is very common. About 20% of children worldwide will be diagnosed with eczema by the age of 1. So super common. It's characterized by more than just dry skin. You're talking about red, irritated patches, commonly cheeks, back of the neck, flexural surfaces is where you'll see it the most. The reason behind eczema is there's a lack of a protein called filaggrin in the skin. Filaggrin is what gives the skin its basic structural integrity. Without it, the skin can't hold on to water and protect itself as well. So that's why you get this dry skin that can oftentimes get red, angry, irritated, and sometimes it can even get infected.
I know a lot about that.
Filaggrin.
Filaggrin.
Have you heard of filaggrin?
I have not heard of filaggrin, but I have eczema. Right?
Okay.
And I had it as a child, and I grew up in the country, right? And so my mom at first thought I was just dusty from playing outside all day. But when
she tried to dust it off, and it didn't work.
It didn't come off. When the dust didn't wash off, then she was like, okay, something's going on here. So, yeah.
It's more than dry skin. Exactly.
Dr. Linkner, why and how is fragrance added? We talked about read that list. You don't want too many things added to any skincare product. Tell us about fragrance. I mean, we want to smell good. We want baby to smell good, but is it a two-way street?
As a board-certified dermatologist, I will tell you fragrance is a big trigger for exacerbations of not just eczema, but also asthma.
Is it really?
Yes, and other things to call out and try and label read for: metals, dyes, fragrances, preservatives like formaldehyde. Interestingly enough, neomycin, which is a very common topical antibiotic, 8% of the population is allergic to that too.